Good morning, everyone. Thank y'all for joining us for this webinar. We're really excited to be having this conversation. We, as an organization, have been involved in the HIV criminalization space, and we're able to reform policies around that in the state a few years ago, and we've been so happy to see similar type of reforms happening around the country. And it seemed for a while that we were really going in a great direction, but as medical and scientific advances continue in the field, there are realistic concerns that come up, particularly when it comes to protecting protecting our communities, securing our privacy, and things along that line. And, as we have been discussing ways to track HIV effectively and taking into account concerns from the community, now we're in a different time. Now we're in a COVID-19 time where people are realistically scared about COVID-19 and are wanting to ramp up efforts to trace people, and they're wanting to create apps, and things are moving very quickly. Yet all of those concerns that were had prior to this time still exist, and in some cases have intensified. So, we thought as an organization it was super important for us to be able to have a space to be able to talk through all of this. And we are so grateful that there are other organizations who are leading in this work and are doing amazing things to make sure that our community is protected pre-COVID-19 and especially now. So we're so excited to have Breanna Diaz from Positive Women's Network USA to be presenting today about this topic, and she's gonna talk about all of the things that we discussed earlier and then some. And I'm so excited for her to be here, and I'm going to go ahead and pass it off to her. If y'all have any questions, please put them in the chat, and we'll take the time to answer them as they come. And of course, in the end, we'll have some time for questions. So if you're not speaking, go ahead and mute yourself, and I'll go ahead and pass it off to Breanna.
Awesome. Thank you so much. I'm going to share my screen now with the PowerPoint. So 1 sec, everybody. Awesome. Let me minimize this. Great. Yeah. So really happy to be joining you all today. I'm here to talk about HIV and COVID-19 criminalization. But real quick about me, my name is Breanna Diaz. My pronouns are she and her, and I'm the policy director for Positive Women's Network USA. And I'm currently located in Richmond, Virginia, which if you know anything about this state and this city, there's a lot going on. So yeah, today I'm going to talk about, who PWN is, COVID-19 criminalization, what that is, whether it's criminalization, policing, or surveillance. I'll get into all three of those. I'm going to go over lessons learned from the HIV movement, since a lot of what is going on right now in regards to COVID-19 criminalization, whether it be how COVID-19 criminalization is occurring and who is enforcing that criminalization, is very similar to what we've seen with HIV criminalization. So there's a lot of lessons that we can teach COVID-19 criminalization. And then I'll talk about some federal action that's going on to address the issue, as well as state action. And I will leave time at the end for questions. However, I recognize that what we're about to go over is a lot of information, and a lot of people on this webinar have personal experience with criminalization. And so I welcome any real-time questions or comments that you all want to make. Because I'm sharing my screen, I will not be able to see the chat, questions raised, or anything, but our lovely co-host will flag for me. So again, questions, about 10 minutes of questions at the end of the presentation. But if you have something urgent, happy to stop the presentation to answer your question. So let's keep this as as much of a conversation as possible, so I'm just not talking at you all. Great. So real quick, Oh, no. Okay. So about PWN USA, we are the only national organization in the US led by and for women and people of trans experience living with HIV. We were founded in 2008 by 28 diverse women living with HIV. And today we have over 3,000 members nationwide. We have chapters in many states and state leads in another 12 states. And I know our North Carolina state lead, Alicia Diggs, is on this webinar. Always great to see PWN repping. I know there's other PWN members on this webinar, so happy to see you all. And our mission is to prepare and involve women living with HIV in all of our diversity, including gender, identity, and sexual orientation, and all levels of policy decision making. So that's a bit about who we are. And why are we addressing COVID-19 criminalization? Why is PWN tackling this issue? Well, we have a policy agenda that's composed of 6 different issue areas, and one of those down here, ending criminalization. We know that people living with HIV, in particular, Black, Indigenous, and people of color, LGBTQ people, women, immigrants, and no to low income folks are criminalized for a variety of reasons. And we know that HIV criminalization is one of the most hard hitting issues for people living with HIV. And COVID-19, again, is eerily similar to how HIV criminalization is enforced. And so, given those similarities, PWN has invested a lot of our time into addressing COVID-19 criminalization. So, I think I've said COVID-19 criminalization probably like 20 times now, and I'm going to say it at least another 100 times. And people might be asking, like, Breanna, what is that? Like, I hear this a lot, is what are you talking about? And I'm going to start with framing North Carolina. So, about 3-4 months ago, I don't know, I'm in week 15 of lockdown personally. And so I can only imagine how much, y'all have been under, physical distancing. But back in March, we saw a slew of states issue public health orders. You might have heard the term shelter in place, safer at home, or just public health order. And, in North Carolina, y'all have had a safer at home order starting in May 22nd, which was a bit of a rollback of the initial public health order back in March for North Carolina. Under this safer at home order, and this is similar with other public health orders across the country, there are penalties for violating a public health order. And so for North Carolina, if you were to, violate your state's order, it is a class 2 misdemeanor. And what that is for your state is a $100 fine or jail for up to 60 days or both. These levels of misdemeanors and penalties vary state to state. It's all based in state law, but a majority, if not all, of these public health orders have some sort of penalty, whether that's you're violating a gathering order, whether that's in North Carolina, starting only this past Friday, there is a mandatory face mask requirement. There's just a variety of ways that you can violate these alleged public health orders, and they're met with criminalization. And so, how are these things enforced? These public health orders are enforced. Well, the executive order, in the May 22nd executive order, specifies that state and local law enforcement officers are the ones who will be enforcing the public health order. And so we can, I think we can already imagine what happens when we use police as public health enforcers. Given the history and context of policing, the racial disparities in policing, when we decide to tie public health order to cops, we are unfortunately bringing cops into, we are enabling police to further surveil and police marginalized folks. So I just wanted to start with that framing of like how y'all are sitting in North Carolina. And one last thing is that even though there is a mandatory face mask requirement in the state, I read that the governor and some local police departments are saying that they will not enforce this face mask mandatory requirement, but again, enforcement is discretionary. So Who knows? One cop could choose to do so. So with that background of public health orders, penalties attached to them, and cops are the ones that are enforcing these orders, I'm going to talk a bit about like what does COVID-19 criminalization look like across the country. And it is one, it's enforcement of these public health orders that I just went over. It's also enforcement through existing criminal laws. And what that means is that as of right now, and to my knowledge, there are no laws in any states that criminalize the transmission or intent to transmit COVID-19. However, we have already seen that states use different laws, criminal laws they already have, to criminalize people for COVID-19. And so what that can be is if you cough on somebody or cough in the direction of somebody and say, I have COVID-19, your state, if it has the law, can slap you with a biological terrorism charge. It can slap you with assault. So we have already seen, unfortunately, both law enforcement and prosecutors utilize existing criminal laws to charge people with penalties related to COVID-19. We've also seen criminalization appear in enforcement through existing quarantine laws. And so what that is let's say you have COVID-19 or you share housing or space with someone who has COVID-19. Many states require you then to self-quarantine, but if you break that quarantine requirement or law where it exists, you can get slapped with additional penalties or charges. And we've also seen the use of ankle monitors in Kentucky, so that way the state and law enforcement can better track people who have COVID-19 or otherwise. So these are kind of the three main ways we've seen COVID-19 criminalization, and I'll break those down a little further. So these are just a couple articles that I've pulled together. Some I've already gone over on how COVID-19 criminalization is showing up, right? We have the ever popular Florida Man article back in May 22nd, where someone from Florida was indicted on a terrorism charge after spitting on a police officer claiming to have coronavirus. This spitting and coughing at cops and then that person being criminalized has happened in more than just Florida. It's happened in Illinois, it's happened in Missouri, it's happened across the country. And this charge, is terrorism charge, does not require the person to actually have COVID-19, nor transmit COVID-19 to be charged. And so I'm sure that sounds very familiar to folks who do HIV criminalization work at the state level. I just mentioned before with the quarantine example that Kentucky is putting ankle monitors on coronavirus patients who ignore self-isolation orders. And while we can have a lot of our own personal thoughts and issues with people who have COVID-19 going out into community, very real fear with transmitting the virus, slapping ankle monitors on people is dehumanizing. It paints a target on their back where the potential for community violence or otherwise is elevated. And so I think it's worth thinking about why we think that public health issues should be met with criminalization and further surveillance of already marginalized folks. And then another article that I'm sure many of you are familiar with was the scrutiny of social distance policing in Brooklyn. This happened, about a month ago, where in one day, cops arrested 40 people for violating New York's public health order for social distancing, specifically the gathering of 10 or more folks. So 40 people were arrested in one day. 35 of those 40 were Black, 3 were Latinx, and 1 was white. So I think that's one of the most upsetting examples of the honestly racist enforcement of public health orders. So, I went over COVID-19 criminalization, how it shows up in our states and in our communities. And now I'm going to go over a bit about COVID-19 and policing. So again, police are tasked with enforcement. I included New York State's executive order, which states, the fire department of the city of New York, the New York City Police Department, and the sheriff, the Department of Buildings, and other agencies as needed to immediately enforce the directives set forth in this order in accordance with their lawful enforcement authorities. That is a mouthful of statutory or order language. That's just boring, but what it's getting at is that police are tasked with enforcement. Again, cops are not the best at enforcing public health orders. We can, I put below that police are not equipped to respond to issues of health. There's no required training on this issue, or training, varies locality to locality or state to state. And most time officers rely on policies and procedures that harm marginalized communities. It also, puts marginalized folks at a greater risk of, getting COVID-19. I know in my community here in Richmond, unfortunately, our cops are not consistently using PPE. So, masks when they're interacting with folks. And so, it's not only are these public health orders encouraging cops to further police marginalized folks, but it puts us at risk when they are, meeting with other populations and possibly transmitting COVID-19 unintentionally, but the potential is real. Are we good? Sorry, I was getting feedback. Okay. So, I also want to highlight that, like I said, that COVID-19 criminalization and policing is happening across the country, but every single order, public health order, is different. How it is being enforced is different, and even like when it's being enforced, because things are just constantly changing. And so I wanted to highlight this really great tool that PWN partnered with Community Resource Hub and ACLU and other, civil rights and social justice organizations on. And it's called the COVID-19 and Policing Trackers. I am real quick going to show you all what that is, and I highly encourage you all to use it to get a better sense of, your state's groundwork. Let me see if I can exit this. There we go. Nope, that is not it. That is my video game player guide. All right. So this is the COVID-19 and policing trackers housed on the Community Resource Hub. I'll go over what the trackers are. There are 2 trackers that we currently have. And one is on laws, orders, and enforcement of COVID-19 public health orders. So you can just go to this chart, and you'll see there's a variety of public health orders. Some states did not have statewide public health orders, but rather left them to cities or counties to create and enforce their own orders. So that's why you might see Alabama, Alaska, and others several times. But you can just click in the search bar, your state. It'll pop up. You can click on it, and it gives you your jurisdiction. Any mandatory things, 6 feet distance is mandatory in North Carolina, facial coverings. What is the gatherings order? 10 people indoors, 25 outdoors. And we also directly link to the orders and legislation for y'all's review. The penalties, enforcement, and relevant statutory language is available. So the purpose of these trackers is to provide just a hub for you all to know what the current landscape is for your state. We also have a second tracker, which is tracking enforcement of these orders. And so some of those news articles that I just mentioned come from this tracker. We are constantly adding to this particular tracker, but again, you can look at when enforcement happened, the age of the individual, race, gender, where, the state, municipality, and otherwise. Let's see, North Carolina. So these are just a few, at least that we know of. We have 4 pages of criminalization related to COVID-19 in North Carolina. So this is just a way for us to hopefully at some point in the near future provide data on who is criminalized, how is criminalization showing up, and any other questions that we have. There's also a self-reporting feature on the tracker where if you yourself have been stopped, ticketed, or arrested due to COVID-19, we would like to know that. This information is confidential. It is secure, and it's just another way for us to collect data on how COVID-19 criminalization is showing up in our communities.
Breanna,
Yes.
there's a question that came up in the chat.
Okay.
Okay, I'll read it for you. Question: when you get to the state enforcement part of the presentation, could you comment on the use of subpoenas when people refuse to share information during contact tracing? Thinking specifically of the New York Times article today about Rockland County, public health officers following up on outbreaks linked to parties that violated the maximum number of people who can gather together.
Okay, so just, thank you. So just to reiterate, thoughts on use of subpoenas.
Yes, when people refuse to share information during the contact tracing process, like what can the state do in that part?
Right. Okay, yeah, great question. I believe that would be state to state, what is actually required. Sorry. So our thoughts are that, I'll address this later in a bill that's at the federal level, and I believe there's also a New York State bill that might get to this issue, that we should not be subpoenaing or allowing the ability to subpoena data purely for punitive reasons, right? I would disagree with the state or like law enforcement trying to subpoena information from individuals that would solely be used to criminalize those persons, whether that's under the public health orders or another existing law. But without explicit protections at the state or federal level, preventing data from being collected for that reason, there's really nothing to stop people from getting that data. I hope I answered your question. If not, I can definitely follow up later one-on-one. But yeah, I just want to get back to that. So I just shared the tracker with you all. I really encourage you all to spend some time with it and get to know what's going on in your state. So now I'm going to talk a little bit about COVID-19 and surveillance. We just talked about contact tracing a little bit, but real quick, contact tracing is the identification, monitoring, and support for individuals or contacts who have been exposed to a patient and possibly infected themselves with a virus, in this case, COVID-19. And how contact tracing is intended to work is prompt identification, voluntary isolation or quarantine, yet we have seen otherwise, and monitoring of a person diagnosed with COVID-19. And their contacts can effectively break the chain of disease transmission and prevent further spread of the virus. Right. So I'm sure we're all familiar, or at least a little bit familiar with what contact tracing is and what purpose it serves. And yes, contact tracing is an effective way to track viruses and stop the spread of viruses, whether they be COVID-19 or otherwise. However, our concerns with the way COVID-19 surveillance and contact tracing is being implemented is that it puts marginalized folks at further risk for being criminalized due to their status, right, of having COVID-19 or otherwise. And so our concerns are a little bit laid out here. We are highly concerned with data sharing with law enforcement. Right now, 35 states are sharing the addresses of persons with COVID-19 with law enforcement. and 10 states are sharing both the addresses and names of folks. Two of the examples that stand out here for me are Massachusetts and Alabama. So what this looks like in practice is that, if once you test positive for COVID-19, your information is collected, you're likely, put into contact with a contact tracer or, whatever the procedure is within that state. But there is a database of folks that have tested positive that is accessible by the public health department, the state public health department, and some of them are sharing with law enforcement or like first responders who those people are with COVID-19. And the thought behind that is that, the state would like law enforcement or first responders to know who has COVID-19. So if they have to go to that person's address for whatever reason, law enforcement is safe, I guess, from getting COVID-19. But there's a lot of holes in that argument or thought process. One being, a lot of the time, like a lot of people are asymptomatic, right? And so who does and does not have COVID-19 isn't always as clear as we think it is. And so a lot of these, data sharing agreements between public health departments and law enforcement have a dated understanding of what COVID-19 is and how it transmits. Second, there's just general privacy concerns, right? Like what our health status is and our current health should not be accessible, I think, without our consent, like informed consent of who it's being shared with and why. And third, we're not really sure how secure how secure this data is. Like, yes, the public health department is holding it and is being selective in who they provide the information to, but who is to say that the individuals receiving the information, law enforcement, are actually keeping that information confidential themselves? So there's just a lot of risk involved with this data sharing, aside from criminalization concerns. We also have a lot of concern with contact tracing surveillance in that, as contact tracing is rolling out in response to COVID-19, we know it is rapidly growing. There is no requirement for meaningful community involvement in how contact tracing is developed and who carries it out. And so when we hire contact tracers, or when we roll out these massive contact tracing programs that are not rooted in community needs, and there is no community outreach to begin with, that kind of builds distrust in a system that has a right to not have a lot of community trust. And so that's a huge concern for us.
Breanna.
Yes.
One question, with what you were just discussing, does that apply also to people who are self-quarantined?
The data sharing?
Yes, the data sharing and the use of surveillance, do these apply to people who are self-quarantining versus, I guess, if they were asked to?
I believe the answer is if you have tested, right, if you've gone and taken a test, your information has been collected at that point and will be shared with the public health department. So self-quarantine, if you've been tested, I don't think is the issue here. But if the question is I have,
they wouldn't know unless you disclosed it, right?
I'm sorry, can you repeat that?
I feel like the government may not know that you're even self-quarantining unless you disclose that in some way, or like you mentioned, if there was a test. So could these rules apply, let's say, if that person is self-quarantining? Because, I think technically at that point, the government wouldn't know. So how would they be able to enforce the laws against them?
Yeah, right, exactly, yes. I think it's if your data is not stored, if you're a COVID-19 test, if you did not take one, but you're sick and you're self-quarantining, then your information will not be shared with law enforcement in this example. I hope that answered your question. Cool, so I'm gonna go into a bit about lessons learned from the HIV movement. I kind of alluded to this a little bit earlier, but like why PWN, I think, and many other HIV organizations at the national and state level are like getting involved in the issue of COVID-19 criminalization, is that how criminalization, policing, and surveillance is playing out in the COVID-19 realm is very much alike how we've seen it in the HIV movement. And so just to reframe, great map, popular map, I'm sure we've all seen, on HIV criminalization in the United States. We know that now, I believe, wow, would it be like 33 states? Washington is still on there, even though they recently modernized their law. Congrats, Washington. We know that states vary on HIV criminalization, and, just setting the framework there. But we have this national plan, right? The Ending the HIV Epidemic. That was launched a couple years ago, and the goal of the ending the HIV epidemic is to reduce by 75% new HIV transmissions in 5 years and at least 90% reduction in 10 years, right? There were 4 pillars to meeting the ending the HIV epidemic goal set forth by the Trump administration. And one of those pillars down here is respond rapidly to detect and respond to the growing HIV clusters, I hate that word, and prevent new HIV transmissions. This is the molecular HIV surveillance portion or pillar of the Ending the Epidemic plan. And why I wanted to highlight this is that, we have at the national level a plan to end the spread of HIV, right? We also have right now at the national level, arguably a plan to stop the transmission of COVID-19. And contact tracing or molecular HIV surveillance are key to stopping the transmission of either. But it's very difficult to, for community to trust these systems of surveillance, whether it be COVID-19 or HIV, when, the environment that we, I want to go backwards. The environment that we live in this could be your state, right? Where your status is criminalized. Your HIV status is criminalized at the state level, or you have a public health order that criminalizes certain interactions and engagements regarding COVID-19. And so we've had a lot of concerns, and I know many on this call have been engaged with concerns around the growth in use of molecular HIV surveillance to to end the epidemic, where we don't have community consent to this type of contact tracing, and we are investing resources and funds into a system while not addressing criminalization at the state level, because there really aren't any guaranteed protections for us when our data is collected with HIV surveillance, that data cannot be subpoenaed for criminalization use in states with HIV criminalization. And then finally, a lot of the CDC offices in charge of implementing molecular HIV surveillance and contact tracing are the same ones that are tasked with doing COVID-19 contact tracing and surveillance. So just kind of wanted to frame that up a little bit about why we're here. And again, just to reiterate, the intersection of HIV and COVID-19 criminalization, we know criminalization undermines public health. We know that criminalization impacts marginalized communities. With HIV criminalization disproportionately impacting Black folks, trans women, and sex workers, that same type of impact will likely be seen with COVID-19 criminalization. Criminalization deepens medical mistrust, which I know Christina framed up that issue, and we'll talk about it a little bit more. And then criminalization reinforces stigma and deters people from seeking testing and treatment, because like HIV, criminalization laws, once you know your status, you're arguably put in a hard position where, like, you want to know your status and take the steps, to be healthy and safe, but criminalization laws or these public health orders can then be used against us in really unfair ways. So that's kind of how we've seen the intersection of HIV and COVID-19 criminalization, and also why we believe HIV organizations individuals, advocates, the actual like community should be leaders on this COVID-19 criminalization fight. So I know I've said like a lot of like bad things. Like I know that information can be a lot. I know it can cause anxiety and panic and anger, and that's valid and real. And there are things that we can do at the federal level and the state level to address these concerns around criminalization, policing, and surveillance. And so first, I'm going to talk a little bit about federal action that we have seen and more action we can take. So I'm going to start with the federal legislation that is the CARES Act. And in the CARES Act, the federal government allocated $631 million in testing, contact tracing, and surveillance. So you might see this in like your state that was like, oh, we're hiring 1,000 new contact tracers, which I think here in Virginia, we're hiring like 1,300, if not more. And this is, like having more contact tracers has been a request by public health officials and, advocacy organizations as like a need, right, to prevent the transmission of HIV or COVID-19 or other communicable diseases. But with this $631 million in funding, unfortunately, it did not include explicit protections on data sharing or like who has access to that data, right? So we still have very real confidentiality concerns with how that money is used. And then I also wanted to highlight the HEROES Act. This act, allocated $75 billion in testing and contact tracing and surveillance. So clearly there is a need for funding to ramp up testing, contact tracing, and surveillance with the hopes that there will be, long-term investment in these tools. But again, there's no explicit requirement that money, allocated from the $75 billion to state or local public health departments ensure that individuals' data is secure, it is confidential, or folks have informed consent on how their data is being used. So I wanted to highlight that. And also, the HEROES Act did pass the House. It is very unlikely to make any movement in the Senate. But whatever a relief package looks like when the Senate reconvenes in July, if they choose to take up a fourth relief package, we can definitely, guarantee that funding for these three things, testing, contact tracing, and surveillance, will be included in that package. So I believe that, in a fourth package fight, which could start in July, that we could start demanding that if we're going to allocate money to testing, contact tracing, and surveillance, that there be explicit protections for folks on their data. So update, just yesterday, speaking of securing data, a federal bill was introduced by Representative Jackie Spear, his representative out of San Francisco, and she introduced the Secure Data Privacy for Contact Tracing Act of 2020. And so this act applies only to digital contact tracing. I probably should clarify this earlier, but contact tracing can occur in many ways. Digital is what's being rolled out, and we have heard has been developed with many folks in Silicon Valley, Google or otherwise, for these applications, these little apps on your smartphone, rather than peer-to-peer or in-person digital or in-person contact tracing. And so what the Secure Data Privacy for Contact Tracing Act does is that it's tied to grants issued by the CDC for contact tracing. And these are grants for states to develop or partner with tech companies to develop these contact tracing apps, right? And so in these grants, there are requirements on how around data privacy and security. And so, the bill would prohibit law enforcement and immigration enforcement from accessing data collected via digital contact tracing. It also prohibits the punitive use of data collected via digital contact tracing. This is great, right? Like, we do not want cops at any level of any kind accessing our data that should be used for public health. It's also great that this bill has explicit language that you cannot, like, data collected via these apps will never be used for criminalization. The act also requires informed consent, whether that be in the app or the public health department engaging in some sort of education or informed consent model for communities so they know what the app does, how their data is being used. It also has a time limit on how long the data can be stored, because we do have fears with indefinite storage of data, right? Like, once it's done, like, just delete it. So there's never any risk of our data being hacked, people ever knowing our status, COVID-19 or otherwise. Like, we just want to eradicate that problem. So delete the data once it's met its use. And also the bill specifies that law enforcement and immigration enforcement cannot be contact tracers regarding digital apps. So we have seen in New York State, unfortunately, that law enforcement were engaging in contact tracing, being the individuals doing the work. That's bad for a lot of reasons. And this bill recognizes that public health departments will, sometimes form contracts with other individuals to participate in contact tracing. And so we wanted to make sure that law enforcement can never be the people that the public health departments contracted with. So overall, I think it's a great bill. And it was just introduced yesterday. I would say be on the lookout for action alerts that are coming out. I know right now we are looking for more co-sponsors on this bill, and we would love to see it either pass on its own or be included in a fourth package in July. But I'm happy to share more information, later on how to get involved. I want to highlight this one bill. We have additional federal recommendations, some of which the digital contact tracing bill addresses, but it doesn't get to peer-to-peer or in-person contact tracing. And so PWN and many other social justice organizations have asked for these 3 requirements in any future federal relief packages related to COVID-19. And it is to explicitly prohibit the sharing of an individual. Yeah.
Real quick, a question came up in the chat. Do we know if individuals are required to share personal info/contact info in order to get a test? Could folks opt out at that point if they have data/privacy concerns?
I actually do not know the answer to that, so I welcome somebody else's knowledge on that.
Mm-hmm. All right, we'll hold on that, and we'll try to find an answer and circle back. All right, Claire, we'll hold that. Oh, yeah. Donna mentioned, yes, we collect personal info when we test. Thanks, Donna, for giving us some insight on that. All right, Breanna, go ahead.
Yeah, thank you, Donna. I love it. These 3 recommendations, the explicit prohibition. We also want all legislation responding to the pandemic must include an explicit prohibition on the use of federal funds for law enforcement to criminalize actual or perceived violations of public health orders around COVID-19. And the federal relief packages must invest in testing, treatment, care, and community support, not criminalization, right? Like, we want to make sure money is going to community, whether that be testing, broadening testing, and not like going to law enforcement to enforce these public health orders, right? And then we also wanted to make the recommendation that awards of federal funding to states and local governments should prohibit the adoption and enforcement of laws criminalizing the potential for or actual transmission of COVID-19. And so that final one is that if you're going to get money from the federal government to address the COVID-19 pandemic, states cannot, nor cities cannot adopt laws or policies that criminalize COVID-19. And so this final one was, came from the concern that when, the Ryan White Act came into existence, in order for states to receive federal funding, they were required to pass HIV criminalization laws because I guess that's what public health looked like. And we want to make sure that that does not happen with COVID-19. It should never be a requirement to criminalize, a virus or, a person in order to receive money. So that's why we have that last one there. So finally, I'm going to go into a little bit of state action because, federal government can do so much, but we can do a lot at the state too. Like these two actions can happen together. So, we are asking for a decoupling of public health from law enforcement. Same with what we've asked for at the federal level, explicitly prohibit the sharing of an individual's health data. Data sharing should be limited to state and local public health agencies engaged in fighting the COVID-19 pandemic, but should not be shared with law enforcement, as we're seeing those 35 states do, like with an individual's address or even their name. Law enforcement should never be used as contact tracers. No, we don't want to put police into more situations where they can engage with folks. We don't want that. And then we also want states to invest in community. So public health departments rolling out contact tracing must partner with community-based organizations, including HIV organizations. Again, the community knows how best to address this issue. They've been doing this for decades. They know their needs. They can speak to their own community. And so I think it's important that when we're rolling out money to develop these contact tracing programs, that community be involved in that process of developing the plans and implementing the plans. And again, prioritize COVID-19 funding to expand testing, prevention, and services. That's where our money should go. It should not be going to any way to criminalize folks. And so I wanted to highlight one state bill that has been worked on by a lot of great state-based organizations in New York. Many of, I think, are on this call. And it's New York Assembly Bill A10500A. Love the bill numbers for New York. But this bill explicitly prohibits law enforcement and immigration enforcement agencies and personnel from serving as contact tracers. Oh, wow, that's something we asked for earlier. And then it ensures that contact tracing information stays truly confidential by making it immune from legal process and inadmissible in any judicial or administrative actions and proceedings. So New York State is so far the only state I know of that has introduced state-level legislation that would that would ban law enforcement from accessing data and does not allow them to be contact tracers. So this is a great example of a state doing the work that we'd like to see. And this bill was developed by and for people living with HIV. Again, Center for HIV Law and Policy played a key part in this bill, Treatment Action Group, and many individuals and state leaders and community leaders. So this is a great example of legislation that other states can replicate. Just some resources, y'all will get these in an email, but just wanted to provide them. But with that, I am done and happy to take questions.
Yay, awesome. I think there may be a question. I'm just going to read this comment. Also want to raise that opting out of voluntary data collection is different from providing affirmative consent. I'm thinking about this from the perspective of people who are hesitant to provide any personal info because of possible law enforcement / immigration enforcement concerns. Could be a deterrent to testing and complicate our picture of who is testing positive. Example, folks can decline to share their race. So it wasn't necessarily a question, but I think it was just a comment.
Great comment.
Do we have any other questions? You can put them in the chat. You can unmute yourself if you would like. Well, I have one question.
Okay.
Real quick. With the legislation that you mentioned, what do you, I guess in your, I don't know if you've had conversations yet with legislators about it or even in the drafting process, but what do you anticipate the pushback would be? Because I'm thinking if in North Carolina we wanted to do something on the state level, I know that our relationship with cops is, different than likely other states.
Yeah. Absolutely, right? Like it's drafting a bill that would prohibit law enforcement from participating in contact tracing will definitely vary based on the environment of your individual state. But I still think it's worth finding, you know, gathering first, I think first, you know, talk with community about what their experience is with contact tracing, figure out where we're seeing issues pop up. The second, I think, is to, you know, work with a legislator in your state that you believe would be open to working on this issue. And I think it's just engaging in, you know, state legislative, like advocacy, but educating legislators on this issue, how it's impacting folks, and that there is a real need to prevent this data sharing, right? Like, I think, you know, the COVID-19 policing trackers and that whole website provides both the data and anecdotal stories to paint the picture that this is a real problem. It's impacting marginalized folks, and in no way is it curbing the spread. In no way is criminalization curbing the spread of COVID-19. And so it's important that if we're going to end COVID-19 or slow the transmission, that we invest in community and build trust, and that requires decoupling law enforcement from public health. How that works, right? Like, is a whole different story. But that's my sense of the best place to start to at least get the ball rolling on state legislative or like a state specific bill regarding contact tracing or data sharing.
Mm-hmm. All right, next question. Are any states thinking about how this will work if and when schools are back in session? So the intersection with school discipline? Yikes.
Yeah, no, that is a phenomenal question. I have not had any conversations on that yet, but that definitely makes sense. So no, I have not engaged in those conversations, but I'm sure that there are individuals at the state or local level already thinking through that. If anyone has information to share, I'd love to hear it, actually.
Another question. Do you know if every state does swab and blood draw COVID testing, or does it vary from state to state?
I do not know the answer to that.
Me neither. Any other questions? Well, someone shared an article. Another important consideration is data sharing of undocumented immigrants.
Right. You know, that's an absolutely great flag. We know that, you know, with the Trump administration's public charge rule that came out, that there's already been a chilling effect of, you know, immigrants of any status, like wanting to access healthcare. And so, you know, this further emphasizes that chilling effect, like with COVID-19, where marginalized populations, again, immigrants, documented or undocumented, are less likely to go seek healthcare if they know that their data is going to be shared with immigration enforcement. So yes, great flag on the compounding of like bad policy and how it impacts marginalized folks.
So Breanna, this is Marco.
Hey, Marco.
What kind of language can we actually use around COVID-19 criminalization and immigration? What a couple of points. I also feel that the surveillance and all of these apps are disproportionately affecting and getting. There is more data collected by Black and brown people than white, right? That's the reality. There is more people that are dying that are Black and brown, and also that are getting transmitted the COVID-19, because there's also the people that are actually in the front lines. Yep. So the white folks, as soon as they realized that they were not getting COVID-19, they just stopped talking about it, right? How can we pressure or just talk in a way that is sort of like that makes sense on regards to immigration?
Yeah, great question, Marco, as always, and great commentary. How do we talk about immigration, right? I think there are already many national and state level immigration organizations that are leading, that have developed toolkits on messaging on how to talk with our community about this issue, both their rights, things to be concerned about, and ways to take action. And one of those toolkits is developed by, their acronym is PIF. I cannot remember the name, but there are resources that have been developed by immigration collectives or groups on this issue. And so that is a resource I can include in the email that goes out to folks. I think is helpful. But, besides that toolkit, I think it's critical that we engage, with our own communities. Again, like what COVID-19 is, how it is impacting folks, as you said, like it's disproportionately impacting and killing Black and brown folks. It's having a chilling effect on immigrants to access healthcare that they have a right to access to. And like you said, like when white folks or people with privilege and power are no longer impacted, it's seen as a non-issue, but we're still dying. We're still hurt. And so I think we have to have these real conversations on, why we're being impacted, ways that we can curb the impact and, take action. So.
There was one question that I missed from earlier in the chat. I'm a social worker in Ohio. What should I be saying to my patients living with HIV to protect them? I guess just generally with everything that you were talking about today, are there tools or things that we could share with folks in the community for them to feel more secure and safe navigating all this stuff?
Yeah, all the stuff. Yes, actually, PWN, U.S. People Living with HIV Caucus, and many other HIV orgs have created a FAQ on COVID-19 and its impact on people living with HIV. So that is another resource I'm happy to share with you.
Thank you. Ooh, all right, we are at 11:01. Does anyone have any last questions before we wrap up? Going once, going to, oh, Jeff? No? Oh, okay. Once, going twice. Done. All right. Well, thank you, Breanna. That was so great. That was so great. The chat box was lighting up. You have a lot of fans there. Very great. Thank you so much for sharing. It's such an important topic that we needed to have, and I'm so glad that we were able to have this space to discuss this. And, everyone just be on the lookout. We will be sharing the PowerPoint, the recording of this meeting, and all of the resources that Breanna mentioned in her presentation that she was going to be sharing. We'll be sharing that out to everyone that registered. So be on the lookout for that. Look out for your email, and we'll wrap up. Thank y'all. Have a good rest of your day.
Thanks, everyone. Love you.
Bye.
Bye, everyone.
Okay,